Auzubillahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Assalamu alaikum to everybody who's tuned into PTV World and are watching World this morning alongside the very fantastic, the very amazing, the very superb, the very exciting, the very on top of her game, ladies and gentlemen. She happens to be Shiza Hashmi and I happen to be Shahzad Hasan Khan. But for everybody who's out there, ladies and gentlemen, it's a fine Monday morning over here in Islamabad. It's getting a little chillier, but everybody in 46 different countries, even if it's your daytime, morning time, evening time or night time, we hope that you're ready to get started with us.
Definitely.
So without any further ado, ladies and gentlemen, we're very lucky that we've actually been joined by a general surgeon. He happens to be Professor Dr. Ahmed Raza Sahab. Hello sir, Assalamu alaikum, good morning.
Walaikum assalam, and thank you very much for having me on the show.
Thank you very much,
It's
sir,
our
for
pleasure,
joining us. Wonderful to have you. And alongside Professor Dr. Ahmed Raza, ladies and gentlemen, we are lucky that we've actually been joined by a consultant diabetologist, and he happens to be Dr. Usman Zafar. Hello, sir. Assalamu alaikum. Subha bakhair. How are you?
Walaikum assalam. I'm fine. Thank you very much for calling me here.
Thank you very much, sir, for joining us. So first things first, Professor Dr. Ahmed Saab, I think I'm going to get my conversation started because what happened was that, ladies and gentlemen, we have this habit of kind of discussing what we'll be discussing on the show beforehand. So while I was sharing my facts and figures with you, so you had to correct a few figures, which is why we never share them. So please let the world know how many people actually are kind of diagnosed with diabetes, what is the reasons behind it, and do you think that they can be saved if they go to an expert in time, if they go to a doctor in time?
Yeah. Okay. Bismillah ar-Rahman ar-Rahim. Approximately 442 million people worldwide are affected with diabetes. As of now, we're speaking, and 1.5 million deaths are directly related to diabetes. I repeat,
Every year.
442 million people worldwide,
That's
and
insane.
1.5 million deaths are directly related to diabetes every single year. And in Pakistan, although the figures are, the crude figures are available, and it's approximately somewhere around 19 million people affected with diabetes. And more importantly, a big number of amputations being done, which are preventable. Thousands of amputations are being done, which are preventable, provided these patients present to the doctor at an early stage.
All right. And sir, in addition to that, I think what I'll do is that I'll actually move on to Dr. Usman Zafar as well, so that because this month is actually dedicated towards awareness and that too about diabetes. So let's get started. I mean, how many types of diabetes are there? And this is something which I know because one of my nephew who's just 9 years old, he was even diagnosed with diabetes as well, and it's been more than a year. I mean, I think that there are different types, type 1, type 2.
Yes.
How does it occur? Why does it occur? That too in kids and in adults. So let's get started with the general awareness.
Thank you. Diabetes, in fact, all types of diabetes have a common thing in them, and that is increased level of glucose in the blood. There are three major types of diabetes which we consider in our clinical practice. One is type 1 diabetes, and this is the diabetes you're talking about in your relative. Usually occurs in the children, and it is because of lack of or inability of the pancreas to produce insulin in the body. The second type, which is the most prevalent type, actually, which is affecting the world, and this is the type which is increasing day by day worldwide, that is type 2 diabetes, which is related with obesity, sedentary lifestyle, overeating, lack of physical activity. So all these things are contributing to, in fact, an epidemic of type 2 diabetes. So this is the one diabetes which is around 95% of the total cases. Third
type 2.
It is type 2. Third type of diabetes is sort of a temporary diabetes which occurs in pregnant ladies. It is called gestational diabetes, and the current figures show that 1 in 6 pregnancies worldwide is affected with gestational diabetes. That too is a very alarming figure because all those mothers who suffer from this type of diabetes, they develop complications during pregnancy. They are likely to develop complications. Their newborns are likely to develop complications. So it's a huge disease, and worldwide around, something close to 45 crore people are suffering from the condition.
And sir, in addition to that, I think, please correct me if I'm wrong, but diabetes can actually lead you towards a lot of cardiovascular diseases as well, nerve damage. Not just that, that your vision can get blurry as well. So there are multiple issues which are related to that, and if that I mean, over here, people, they have this very basic concept, because I have an uncle too as well in my family who's diabetic. So what they think is that, okay, if the doctor has prescribed them with an insulin injection, so they give themselves an injection. But unfortunately, what they do after that is that they can eat everything. This is something which they say very regularly. Oh, putter, injection la liya, hun jo marzi kha lo.
Yeah.
So, may it be
It's a
4
very
gulab
common
jamun, may
action.
it be 5 gulab jamuns or 6. They'll be like, okay, now I've actually given myself a shot of insulin, and I can do whatever I want to do. Is that true? Is that correct? Or is it correct in different kind of cases? Can that happen?
No, I'll first talk about the thing you highlighted about complications.
Yeah.
Diabetes is the single largest cause of heart attacks
Oh,
worldwide.
wow.
It is the most important factor contributing to people going to dialysis machines, developing adult blindness, amputations. So all these things are directly related with diabetes, and diabetes is the largest cause of these complications. So it is very important that this condition is properly managed, and it cannot be managed unless we take appropriate medication as well as the required lifestyle changes which are prescribed by our physician. And they include doing physical activity regularly and taking care of our diet.
All right, wonderful.
What you were talking about.
Yeah, all right. So, you know what? It's actually really alarming when we say that this happens to be the biggest cause of, well, multiple other diseases. But moving back to you, Dr. Saab, I want you to sort of explain, is it, if someone develops diabetes, are we at the risk of, I mean, is it going to spread all over the body in terms of the disease itself? And one more question, since my mom is watching the show, and everyone in my family has diabetes, unfortunately. She just messaged me asking, ask Dr. Saab if all her children are at risk too.
I'll answer your second question first.
All
Yes,
right.
it do runs in the families, but it's a type 1 diabetes. I repeat, there are two types of diabetes which are common. One is the type 1, which makes the 5% of the total cases, and the second one is the type 2, which makes a bigger chunk. And the type 2 is related to obesity.
Okay.
90% of the type 2 patients are either obese or overweight. So these two diseases are so strongly and well knitted and intertwined. The reason being that in obese patients, there's excess amount of fat, and when the fat breaks down, it's technically known a process of lipolysis that raises lipids in your blood, and these lipids at a cellular level make it very difficult for the insulin to have an impact on the insulin receptors. So they make the cells which are responding to insulin resistant to insulin, right? So these are the cells present on the fat cells and liver and muscles. So they become resistant, and that's how the blood sugar level goes up, because the basic function of the insulin is to transfer blood glucose inside the cell.
Exactly. But sir, in addition to that, obviously you have to kind of go back to where Shiza actually asked you the first question.
Yep.
But in addition to that, now since Dr. Saab actually mentioned that your sedentary lifestyle, your obesity, can actually be a big reason behind you getting diabetic. Now imagine that, God forbid, if you have been diagnosed with diabetes and you're changing your lifestyle from sedentary to being very active, diabetic foot is very common as well. And usually what happens is that even if it's like a little bit of nudge to the foot, it's actually going to convert into a very different kind of case where, eventually you had to rush to an emergency to kind of, God forbid, amputate your fingers and the thumb, or probably the foot or the leg as well, just so that it does not spread all over the body. How do you think that, if you're moving from sedentary lifestyle, God forbid you've been diagnosed with it, and now that you want to exercise and work out so that Allah kare ki, you maintain your diabetes and keep it under control, how can you avoid yourself from getting such kind of wounds onto your feet as well, or onto your hands, or any part of the body?
Well, actually, first of all, figures 15 to 25% of the patient with diabetes have got lifetime risk of developing diabetic foot.
Yeah.
And these diabetic foot presents to doctors, in Pakistan, unluckily at a later stage. I would like to share some slides with you.
Yeah, we do have some slides over here, so we're going to share how the diabetic foot might look. But we have taken out the scary ones because, it eventually, God forbid, if not taken care, it gets quite scary as well.
Well,
so
that's the case in which, the subcutaneous tissue and the skin is involved. And that's the earlier stage with which the diabetic foot presents. And we label technically it as cellulitis.
Okay.
That's the scenario. Can you please switch to the previous slide?
Yeah, can we please go to the previous one? Yes.
That's the scenario in which we can prevent the complicated disease by just simply adding antibiotics and conservative measures. And these conservative measures include, elevation of the limb, applying crepe bandages, and the issue is resolved. But the next, can you please switch to the next slide?
Yeah, we're going to move on to the next one. Yeah.
This is the worst form in which the ulcer develops, and technically ulcer basically is a non-healing wound. Now, if you look at it, the skin is lost, and the subcutaneous tissue and the deep tissues are involved. And now the process of the healing is slowed down, because that's the characteristics of the diabetes. Reason being, there are multiple factors involved. One is a neuropathy, second one is angiopathy, and the third one is reduced immune response, and the fourth one is the high sugar levels.
Right.
These all multiple factors contribute to delayed healing, right? And
or God forbid, no healing at all.
Or no healing at all.
And then that's where you actually have to resort to, God forbid, amputations.
Yes, and if not treated, these cases then worsen, and they end up in severer forms, which is an abscess or a localized collection of pus, or gangrene for that matter, what you're talking about, which may end up in amputation of toes and sometimes even the lower limbs. So the key message to your viewers is, the moment you find out that there's some problem with your foot, refer to the doctor. Go to the right person who's trained and skilled to get you back to the
Exactly, which is why I said, I'm very quickly move on to Dr. Usman Zafar over here as well, because my question still stands. That, if somebody is moving from or having a transition from sedentary lifestyle to being really very active, this is something which will happen to them very regularly and quite often. And no matter the kind of shoes you're going to buy, because we have done that all for our uncle as well. So we have bought different shoes so that we can protect him. But now, obviously, he has to go out for a walk, probably, he's so carefree, he actually goes for a ride on a motorbike as well. And then, there are multiple issues which, obviously, you will once in a while come across a situation of such sort, and we want it to heal, right? Do you think that, God forbid, if you've got a diabetic foot, you really need to be on the bed, just rest yourself and keep those bandages on? How do we treat it?
Okay, for diabetic foot, main thing is preventive measures.
Okay.
And these preventive measures include daily examination of the foot.
Daily.
We usually say to our patients कि अपने पाँव का ख्याल ऐसे रखें जैसे आप अपने चेहरे का रखते हैं. It is about looking at your feet twice or thrice daily, applying moisturizing creams on them so that any sore area heals very quickly. Second is selection of a footwear. It should be a footwear which is not injuring the foot. And the third thing is, once, God forbid, you get an ulcer or an injury, you should go to a doctor immediately and get treated for it. And thirdly, there are specialized footwear available, which in case of ulcers
can be given to a patient, which offload the affected area. Is it medicated foot care?
It is medicated. Yes, it is medicated, and basically it is a person specific.
Can you name it? The brand itself, so that
It's not about brand.
It's available.
They can be made on machines specific to a person. For example, a person has an ulcer on the heel. He will need a different type of footwear than a person who has an ulcer on the ball of the foot. So these are specialized. Yes, and they can be worn, and they offload the affected area, and healing is, in fact, it gets accelerated.
All right, so here's the thing, you both, mashallah, happen to be at the Akbar Khan Niazi Teaching Hospital as well, so I think you must be, of course, very appropriate to answer this. Now, as a student in my secondary school as well, I do remember we had a diabetic patient in our school, and she was a junior to me at that time, and she had a bracelet saying diabetic, which helped everyone a lot, because first of all, the first time ever she needed special attention, no one knew what to do or what went wrong. Everyone thought it's maybe something was wrong with the lunch. Then the teacher noticed the bracelet and provided them with special attention.
Yes.
Now that is the one and only instance I've seen something like that. And ladies and gentlemen, this is a request actually I want to make to all the family members out there of not just diabetic patients, but anyone who requires special care. I do remember recently an elderly person with dementia, Shazad, got lost in over here in this very city, and I happened to know them somehow. And I wished somehow maybe they were wearing a dog tag, or maybe they were wearing a bracelet which said their condition, so that people can provide them with help. So you tell us, because it is often prevalent in children as well. So in such a situation, when you come across a person, first of all, what should you do? What is the first aid people should be able to provide to them? And where should they take them?
Okay, people with diabetes are very likely to have hypoglycemia, that is low blood sugar levels.
Yes.
And these low blood sugar levels are very dangerous, and they can result in complications and sometimes even a danger to the life.
Okay.
So it's a very good idea that children especially, they wear a bracelet which tells everybody that they are diabetic.
Yes.
So in case of any children falling unconscious on the street or in the hospital,
Or drowsy even?
or becoming drowsy, or becoming or feeling unwell, one thing which is very important is checking his or her blood sugar level immediately.
Okay.
And if the blood sugar levels are low, then providing them with some sweetener, some juice or a candy which the patient can take, and his condition can revive back. If immediate checking facilities are not available, then we'll presume that they are hypoglycemic, they have low blood sugar level, and there's no harm in giving them glucose or something sweet.
Okay.
All right.
Okay.
But sir, in
Brilliant.
addition to that, this is one thing which I just recalled because I've landed into hospital twice or thrice in an emergency as well. But they will check all your vitals, but they won't check your blood sugar level. This
In
is something
fact,
which
it
I'm
should
going
be
to talk
checked.
about.
Why?
In fact, it
Because,
should be checked.
they're going to check your blood pressure, they'll check your heart rate, they will take your pulse, they'll take everything. But I've never seen any SOP of such sort where in emergencies within hospitals, they will check your blood sugar level. How do you think that this message really needs to go out into the emergency wards as well, into the hospitals, because you two happen to be doctors yourself? Please go ahead.
Actually, it depends on which hospital is entertaining
I
you.
mean,
To be honest
whichever
with you.
one is
No,
closest to you, that's where you land in an emergency.
if you're in a tertiary care center like Dr. Akbar Niazi Teaching Hospital, we go with all the recommended protocols.
Okay.
Right, and especially in such patients like the way Dr. Usman mentioned, who are drowsy kids and suspicion of hypoglycemia, yes, you do check blood glucose. And it's addressed there and then, because it's an emergency. Hypoglycemia is an emergency, which sometimes can be serious and even deadly. Correct me if I'm wrong.
Yes.
Exactly. And in addition to that, sir, towards the end of this segment, just one last thing, very simple, which I want to kind of talk about, and that is that, so over the period of, one's life, whoever's diabetic, they actually go to at least 10 or 15 doctors who are specialists in, for example, diabetologist as well. Now, what happens is that every other doctor you're going to go to, because people think on their own that, I probably need to change my doctor because my sugar is not maintained, or,
I'm not getting better.
my diabetes is not maintained. So, one doctor you go to, he will actually kind of recommend you to get an insulin injection. The other doctor you'll go to, he'll be like, sir, stop the injection, please start taking these oral medicines as well. Now, how does a very normal layman person like me decide whether which doctor is good for me? Because no matter what happens, every other doctor you go to, number one, this case will definitely kind of pop up. And number two, how long does it take your body to kind of start rejecting the kind of treatment you're taking if it's been a longer period of time, please?
Okay. People usually change doctors. In fact, they need to change their ways.
Okay.
And doing
that was a good one.
Yeah.
taking more precautions. Secondly, there is a need for a standardized diabetes care protocol at the national level, and some people who are working in diabetes, they are working on this idea with the government as well, that there should be standard protocols, and there are not different methods of treating from different physicians.
Okay.
So if standard protocols are applied, standard protocols are accepted by everybody, then people will not be confused, and people will not be having different treatments from different people. One thing is this. Secondly, every doctor is good. You go to a doctor after consulting many people, taking their opinions, feedbacks. So I will not say that who is a good one, who is not a good one. Yeah.
I think it's
Everybody
about
is qualified.
suitability as well, of course. Some people.
One very important point I would like to mention here is the doctor-patient relationship is based on trust.
True.
Of course, yes.
Right? If the patient trusts the doctor, he's going to follow the command, right?
Okay.
He's going to take the medicine that way the doctor has prescribed, and that's going to help. So, leave it up to the patient to decide who's the right doctor. But having said that, things have to be institutionalized as well. Like talking about Dr. Akbar Niazi Teaching Hospital, if a diabetic patient somehow, comes to my clinic, I would straight away refer him to respected Dr. Usman because he's a diabetologist.
And it is important.
Yeah, and
Right.
if he needs a medical care. And a similar way, if a diabetic patient needing a surgical care goes
He's
to
going
Dr.
to recommend
Usman's
it,
clinic, he will straight away refer it back to the surgeon.
Exactly,
to
and
the
it's
right
that's
wonderful.
the professional way.
And this is how it works as well. The entire team kind of comes together to kind of look after people. But sir, very quickly, because this is something which we have missed out on, and I want people to kind of realize, because the majority of the people, because the facts and figures say that almost every fourth adult over here in the country has actually got diabetes, maybe any type of diabetes. But God forbid, if somebody who does not know that he or she might have diabetes, how can they feel in their daily routine? I mean, so I don't know, God forbid, if I have diabetes, but God forbid, if I have diabetes, how do you think I should feel? Do you think that my mood will be on the lower terms? I'll be a little drowsy, I'll have
Your
headaches,
vision.
or probably what's going to happen to me to figure out whether I'm diabetic or not, God forbid.
Usually patients with diabetes come to us with two main problems.
Sure.
One is unexplained tiredness,
Okay.
and second is weight loss.
Okay, wait.
So if somebody is having weight loss or a tiredness which he cannot attribute to anything, then excessive urination, an urge to wake up at night to urinate, then
That's the time they really need
yes,
to come
yes,
to a doctor.
excessive thirst or feeling hungry all the time. So these are the classical features with which diabetic patients may present to a doctor.
All right.
All
So,
right.
ladies
Thank
and
you so
gentlemen, this is
much.
all about diabetes, which we wanted to share with you today. But thank you, very much, doctors, for being with us. Lovely to kind of be in conversation where we are not the ones who are actually paying. I think that's wonderful as well. Free consultations today.
Free consultations. But thank you, gentlemen. This is definitely, service to the public. Of course, we are raising awareness and sort of telling the population where this is one of the most common diseases as well.